Diabetes affects people from all walks of life globally. A total of 537 million adults between the ages of 20 and 79 live with diabetes. Diabetes was once said to be a disease of the rich, but three quarters of those affected are citizens of low and middle income countries. One in every 12 persons suffers from diabetes worldwide. One in every two people with diabetes does not know they are diabetic. One life is lost globally every 7 seconds due to diabetes. By 2030, it is predicted that the number of people living with diabetes will rise to 643 million, and by 2045 it will reach 783 million. So, what is diabetes? To answer that, first we need to understand the role of insulin in our body.
Our bodies are made up of different organs and they do different things. One of them is the pancreas. The pancreas is where insulin is made, and when you eat something, your digestive system breaks down the food so that it can move through your blood and into your cells. Carbohydrates are broken down into glucose, which is a type of sugar. Your cells use glucose as fuel, and insulin moves glucose out of your blood and into your cells so that your body can create enough energy to get you through the day.
When you have type 1 diabetes, your body's immune system attacks the insulin producing cells in your pancreas, so you can't produce any insulin. This process destroys the cells in the pancreas that make insulin, called beta cells. It can happen for months or years before any symptoms appear. When you have type 1 diabetes, your body still breaks down the carbohydrates from food and drinks and turn them into glucose. But when the glucose enters your bloodstream, there is no insulin to allow it into your body cells. More and more glucose build up in your bloodstream.
So, what does this mean? The body tries to get rid of excess glucose through kidneys by making you pee a lot. This peeing a lot causes another symptom of diabetes, extreme thirst. Because glucose cannot enter cells to provide energy, you will feel incredibly tired. To try and get energy, body breaks down the body fat as fuel and causes weight loss well before the diagnosis of diabetes is made. These symptoms occur very early, maybe in days or weeks. Hence, people having the symptoms of increased pain, incredible thirst, extreme tiredness, and excess weight loss should see a doctor as early as possible.
A simple blood test will let you know if you have diabetes. If you were tested at a health fair or pharmacy, follow up at the clinic or the doctor's office. That way, you will be sure that your results are accurate. If your doctor thinks you have type 1 diabetes, your blood will be tested for autoantibodies. These are substances that indicate your body is attacking itself and is found in type 1 diabetes but not type 2. You may have your urine tested for ketones too. These ketones are produced when your body is burning fat for energy. Having ketones in your urine indicates that you have type 1 diabetes instead of type 2.
Si padeces diabetes tipo 1, tu cuerpo requiere insulina, que puede ser usada en inyección o en una bomba de suministro constante. También se debe verificar los niveles de glucosa en sangre, que no deben ser muy altos ni muy bajos. Para ello podemos usar un dispositivo de prueba de glucosa o glucómetro. Con el uso de la insulina, el paciente se siente mejor y sus niveles de glucosa en sangre bajarán.
Managing glucose levels is important because over a long period of time, high glucose levels in your blood can seriously damage your heart, your eyes, your feet, and your kidneys. But with the right treatments and care, the long-term effects of diabetes and high glucose levels can be managed.
Unlike many health conditions, diabetes is managed mostly by you with support from your healthcare team. Managing diabetes can be challenging, but everything you do to improve your health is worth it. If you have type 1 diabetes, you will need to take insulin shots or wear insulin pump every day. Insulin is needed to manage your blood sugar levels and to give your body energy. You can't take insulin as a pill. That's because the acid in your stomach will destroy it before it could get into your bloodstream. Your doctor will work with you to figure out the most effective type and dosage of insulin for you.
You will also need to do regular blood sugar tests. Ask your doctor how often you should do your blood sugar level test and what your target blood sugar level should be. If your blood sugar level close to the target will help you prevent or delay complications. Ensure you do your eye checkup once a week.
The main difference between type 1 and type 2 diabetes is that type 1 diabetes is a genetic condition that often shows up early in life, and type 2 diabetes is mainly lifestyle related and develops over time. With type 1 diabetes, your immune system is attacking and destroys the insulin producing cells in your pancreas. In type 2 diabetes, your body is unable to make enough insulin, or the insulin you do make does not work properly. Type 1 diabetes affects 8% of everyone with diabetes, while type 2 diabetes affects 90%. Type 1 diabetes cannot be prevented, but type 2 can be prevented.
It is still not understood why some people get type 1 diabetes and others do not, or why the immune system of someone with type 1 attacks the cells that produce insulin. Research on this is still going on, and researchers are learning more and more about type 1 diabetes. One day we may find a cure.